good morning to you. I'm Alison Fleetwood. I'm Diocesan Healing Advisor and I'm a GP in South Cumbria. Good morning. It's lovely to have you with us this morning for this webinar. We are expecting just a few more people. You know what it's like letting lots of people in on Zoom. It takes a while. So thank you for bearing with us. But I think we will get started. So yeah, let's officially start now. So I shall hand over to Bishop James. Thank you.
Thank you, Alison, very much indeed. And can I begin by welcoming all of you very, very warmly indeed to this very timely and very important webinar. I'm so glad that you've been able to make time to be with us, and so glad too that this is a truly ecumenical gathering. It's lovely to see all of you, albeit virtually. And also very grateful to Dr. Alison Fleetwood, who, as she's already mentioned, is our healing advisor here in Cumbria, to Archdeacon Vernon Ross and Sarah Mackey and all the others who've been putting the programme together. Thank you for all your hard work and skill. And of course, thank you too, before we get going, to a stellar cast of contributors from whom we'll be hearing later. I indicated that this is a very timely webinar because, of course, as we're all very well aware, the COVID pandemic has exacerbated many existing mental health issues, as well as creating some new ones. Experts, so-called experts everywhere, are predicting a tidal wave of problems in the coming months. And a little so-called recovery group in the Church of England, of which I'm a member as lead bishop on health and social care, that group put together a sort of a la carte menu recently of useful resources, including a number of courses which are on various websites now. But in terms of information and in terms of encouragement actually to do something, whether it's for ourselves and our own mental health, and I know that many of us have been deeply affected by the pandemic and everything that it has involved and continues to involve, whether it's for us or for the congregations and the communities that we serve. This webinar provides a really excellent opportunity to become more aware of some of the many issues that are involved, and to hear about several of the inspirational initiatives that are taking place locally and could perhaps be replicated where you are. Healthy, growing churches are churches which look outwards, churches which discern the needs of the communities in which they're set, and churches which do something to help meet those needs. And that's just such a significant part of our own calling as Christian disciples with our varied ministries. And this webinar is a serious step along the road to serving other people, the people around us, at a time of particular need. And it's wonderful that we have such a galaxy of local expertise and wisdom to guide us. As well, later on at the end of the webinar, as well as Gillian Strain from the Guild of Health and St. Raphael, who'll be talking a bit about healthy healing hubs. So thank you for being here. It's great to see you. And that's enough from me for the moment. And I hope you will benefit from the next couple of hours as much as I know I will. And it's my pleasure and duty now to hand over to the Reverend Andrew Dodd, who is President of Churches Together in Cumbria and who's going to lead us in our opening worship. Thank you, Andrew.
Psalm 139. O Lord, you have searched me and you know me. You know when I sit, when I rise. You perceive my thoughts from afar. You discern my going out, my lying down. You are familiar with all my ways. You hem me in behind and before. You have laid your hand upon me. Such knowledge is too wonderful for me, too lofty for me to attain. A short video drawn from the verses which follow there. Where can I go from your spirit? Drawn from The Dawn here at Hawkshead Hill, and a song by Alison Krauss. Sarah, if you'd like to share the screen.
Will do.
Are we having problems?
Yeah,
Sarah?
yeah, it's just on its way. Can you
All
hear?
right. Okay.
Oh, hold on.
We need the video.
Yeah, it's just on its way. Hold on. It's just downloading again.
No.
Yeah, it's all right. It's all right. I know I've got the.
No, I suggest that we move on. We're missing time. No, that is.
Apologies, I can play it now. Hold on. It's just downloading again. Sorry about this, everyone.
The song is drawn from the rest of the verses of Psalm 139, and it comes from the Americana tradition, which I find is a wonderful medium of crossover between people of faith and contemporary music, and this engagement with the real world, as it were, in the artistic form, seems to have a ring and a heart to it, which speaks to many people, and it's a medium of ease where God's grace works through music and art. I don't think you're going to get it, Sarah, are you?
We've lost. It should be coming now.
Unless it comes now, we'll carry on.
Is that working for you, Andrew?
No, it's not. Well, it might do if it came on screen.
Oh,
no. I'm afraid the technology's got the better part of us. Do stop it. I'd like to just close. It would have been a song and video drawn from the Dawn chorus here at Hawkshead Hill, where a number of times I would dash out as the dawn was breaking and take videos of the dawn. But this is a morning offering from John O'Donoghue, and so we hear this morning offering as a prayer of thanks. I bless the night that nourished my heart, to set the ghosts of longing free into the flow and figure of dream that went to harvest from the dark, bread for the hunger no one sees. All that is eternal in me welcomes the wonder of this day, the field of brightness it creates, offering time for each thing to arise and illuminate. I place on the altar of dawn the quiet loyalty of breath, the tent of thought where I shelter, and all beauty drawn to the eye. May my mind come alive today to the invisible geography that invites me to new frontiers, to break the dead shell of yesterday, to risk being disturbed and changed. Amen.
Thank you. Thank you for that. And yeah, there are suggestions in the chat there that we send the video out afterwards, and we'll do that because I would really love to see that. Thank you, Andrew. So just to say a little bit about the outline of how the morning is going to work, just so that you know where we're going. We're going to be hearing what I'm calling mini presentations, because they're 5 minutes each, from various different people across the morning. And we've grouped it into 3 chunks of 3. And then in between times there will be breakout rooms, a couple of breakout rooms, and there's a comfort break in the middle. And then at the end we will be hearing from Gillian Strain, who's going to be zooming in from London, about Healthy Healing Hubs. So that's our kind of outline for this morning. Because of the wonderful response that we have 65 people, we've got 10 speakers. We've decided it's not realistically feasible to take questions after each and every speaker, because it would just double the time, you know, when we stop here this afternoon. Lovely as that would be, we have, you know, 2 hours, 2 and a bit hours on Zoom's enough for most people, isn't it? Therefore, if you have questions, they may well be answered in your breakout rooms. There will be one of the speakers will be in each of the breakout rooms, sort of in a facilitative capacity. So do ask questions there, and also put them in the chat if they've not been answered. If you put them in the chat at the end, Sarah will save those, and then we will distribute them to the relevant speaker, and we will send you a response to your question afterwards. In the breakout rooms, we will be doing some, whichever speaker you've got with you, will be doing some, taking some notes, if that's okay. Clearly, if there's something you don't want to be made a note of, just say, that's absolutely fine. But that's because we would really love this to be very much a two-way process. One of the things about lots of people on Zoom is it can easily become quite one way as talking at you, and that's not what we want to do. We very much want this to be a two-way process. So, and we want to gather together and hear from you how things are and what's going on, as well as hear from some people with examples of ideas. So it is being recorded, thank you, and the recording will be put up on the Dyson website after, I believe. But the breakout rooms are not, it's only the speakers, the worship and the speakers that are recorded. Okay, so we're now going to move into our first little group of 3, and we're going to start with Dr. Deb Lee, who's going to, who's from NHS North Cumbria, and is going to give us a healthcare perspective on mental health post-COVID and what's happening in the NHS. So over to you, Deb, thank you.
Thank you very much, Alison, and thank you very much for inviting me and giving me the opportunity to talk to you all. And it's fantastic to see so many people across churches together in Cumbria, and some familiar faces as well as some new ones. For those of you that don't know me, I was a paediatrician in the West, but I also have responsibility right across Cumbria. So when COVID broke, the council started a bereavement support partnership, Cumbria-wide, which I chair, and one of the attendees, David, sits on that. So I've been asked to give the NHS perspective, but Bishop James, having had the prerogative of going first, has nicked most of what I was going to say. Thank you, Bishop James. But it's over 50 years since I became a medical student, and the last year there's been nothing like it in my medical career. The intensity of the NHS almost overwhelmed, and we've seen what happens in India at the moment when services get overwhelmed. My daughter works in the biggest intensive care unit outside London. She works in Birmingham, and in 1 week 100 ventilated patients had to be transferred out of her hospital to other hospitals, and that was the nature of the medical problems. And obviously that led to huge stress, not only for the staff working, but also for the families of people who were seriously ill, who are suffering long COVID. And obviously when your loved one died, the restrictions that the COVID caused meant that bereavement couldn't start. You couldn't start your bereavement journey because of the restrictions. You couldn't say goodbye to your loved one. So there was huge stress. And we knew that before COVID, the mental health services were under huge pressure. And there was a sort of backlog already building because of underfunding in relation to basic care as well. And we know that social care had been underfunded for years and years, and government after government has not addressed inequalities. And of course, COVID exposed that lack of funding in social care and the inequalities. I was really struck by what Bishop James said about healthy churches need to look out, and the NHS has finally realised that a healthy NHS looks out as well. And the new paper, I think, offers churches a fantastic opportunity to collaborate and be part of your neighbourhood, to make a difference in your neighbourhood and to support the NHS, both in mental health and bereavement issues. And there's, as Bishop James said, there are lots of training opportunities, and I'm sure together the expertise that you as clergy and pastors in your communities, please keep an eye on what's happening, and I'm sure that Mike Comfrey will talk a little bit more about it. So although it's been a really tough year, I look forward to the future, and a bit like Andrew's video that we couldn't see of new beginnings and a new dawn, this really is a new dawn, and after 50 years in the NHS, I'm really excited to be part of it.
Thank you, Deb. Thank you very much. And I have to say that resonates. I'm a GP, and that resonates so much for me. Yeah, not been a year like it. And I think with, you know, having a head in the medical world and also doing some stuff in church circles, yeah, I really resonate with that. Thank you. So now we're going to go down to the south of the county, to Mike Comfrey, who's going to talk to us about a public health perspective. So over to you, Mike.
Thank you very much, Alison, and thank you, Deb, for the warm-up. Good morning, all. I'm very grateful to everybody who's put this together, and I'm flattered to have been invited to come and talk to you from a public health perspective. I'd like to start by just exploring what we mean by public health. It's a broad subject, sometimes misunderstood. When we think about public health, we tend to go back maybe 200 years. And those of us who consider this agenda tend to think of 4 waves of public health intervention. So public health is primarily about population level interventions to improve the well-being of the population as a whole. The kind of early days, the first wave of public health, I suppose we would associate with the likes of Chadwick and sanitary reform in the 1830s, and the Poor Law Acts that came out at that time. And then we move on to what we might consider as the second wave of public health, which is the kind of application of scientific methods to public health. And I guess one of the key figures there is that great mathematician and nurse, Florence Nightingale, and the work that was carried out in the Crimea at that time. But application of scientific method and scientific approach at population level. What we tend to think of as a third wave of public health sits around the post-war settlement, so the development of the welfare state, expansion of education system, and improved housing. And then more latterly, and I think where most people see public health sitting currently, is what you might call a focus on the individual and education. So the nagging that we've all had for the last 20 or 30 years to take more exercise, to eat more fruit and vegetables, to stop smoking and so forth, and to manage our alcohol consumption. But those of us in the field have been thinking for some years about what the fifth wave of public health might look like. And my feeling is that COVID's probably accelerated that. Now, definitively, this will come to posterity to decide what a fifth wave was. But it seems increasingly that that fifth wave will be addressing inequalities. Deb alluded to that. One of the things we've known for some time is that those people in our poorer communities tend to die considerably younger than people in our more affluent communities. They also spend more years of their relatively shorter lives in poor health. And our great fear is that that may be exacerbated by the events of the past 12 months or so. But optimistically, I think there's a much greater recognition, both nationally and internationally, of the importance of addressing inequalities. So just keep that in mind as we think about the mental health impacts of COVID. It wouldn't be public health if I didn't throw in a few numbers. So just for Cumbria, we've seen about 28,200 people testing positive for COVID over the course of the pandemic to date. That's about 5.5% of the population of the county. Very sadly, nearly 1,500 people have died where COVID's been recorded on the death certificate. More optimistically, as we move into what I think we all hope will be a sustained recovery phase, 70% of the adult population now, approximately 70%, have had a first dose of vaccine, and that's over 90% for those people who are aged 50 years and above. And currently our case rates in Cumbria are low, with 32 cases identified in the most recent week for which we have data available. So to come back to the mental health agenda, Deb mentioned that we have a county mental wellbeing, mental health partnership. Deb sits on that, and we work very closely with the bereavement partnership, which, as Deb mentioned, she chairs. That partnership was put together and actually met for the first time on the day that the Prime Minister announced the first lockdown, the 23rd of March, I think, the day I think that's etched in most of our brains of last year. But that brings together colleagues from the NHS, both from a commissioning perspective and a delivery perspective, as well as third sector organisations, the County Council and other relevant partners and expertise. And what we've focused on as a partnership is population level interventions. So again, Deb very kindly stepped in and pulled together a bereavement partnership. We recognised very early that bereavement would be an issue for people, not just people bereaved directly by COVID, but because ordinary practices around grief and bereavement would be disrupted by the social restrictions that were put in place. We worked to get information out to all the households about looking after your mental health and well-being during COVID in the Every Life Matters booklet that most of you should have had. Developed a directory of resources for use by GPs. We commissioned, or health colleagues commissioned, online support for anybody who felt they were struggling with their mental well-being and health. And we spent some time trying to consider appropriate metrics. And I think this is an important one. We considered what I call precipitative metrics. So things that we really worry about mental health well-being are yet to see them. So what will be the rates of unemployment? What's the economy going to look like over the course of the next 6 months to 2 or 3 years? Because there are strong relationships between economic downturn and population mental well-being. And the key bit with that partnership is it's worked very closely with the communities group. So in each of the 6 districts, there is a local resilience forum. I know Vernon sits on the one in South Lakeland where I have my day job. I don't think I said actually that I'm the mental health lead for public health at the start. I should have introduced myself properly. It's assuming you all know, but I lead for public health, mental health in Cumbria with the County Council. But our partnership works closely with the 6 district resilience groups that bring together all sorts of interests, faith interests, third sector interests, statutory interests at a district council level. And we work very much because our key part of our recognition is the importance of community resilience, community connectedness in terms of population mental health and well-being. If we consider the impact of something like COVID or COVID on mental health and well-being, King's Fund research, international research conducted by the King's Fund, suggests that somewhere between 15 and 20% of the population may develop mild to moderate mental health issues as a consequence of the pandemic, and that's things like insomnia, relatively low-level anxiety. More disturbingly, 3 to 4% of the population might develop more complex pathology, so things like post-traumatic stress disorder or moral injury. So part of our concern is to what can we as a partnership do to mitigate the potential pressures on statutory and voluntary sector mental health services. So I'll try and wind up. I'm not sure how, I didn't time myself on this, so I could go past it. So blow the whistle if I go past it. But broadly, I would suggest two things. Some of you will heard me say this before. It's really, really important that we look after ourselves. And the simple messages I would say to consider what we call the 5 ways to well-being. Really important is to connect with others. That's been really difficult for people. It's obviously been nigh impossible to do that physically for many people, but to try and stay connected, use your telephones, use these various ways of connecting visually on Facebook and WhatsApp and so forth. But stay connected, reach out to others and reach out yourself. Be active if you can. I think there was a group of people who felt that we were obliged to go and take an hour's exercise every day during the first lockdown, so that didn't do any harm to some people, I'm sure. But try and be active and pay attention to the world around you. So be mindful. One of the things I always say to people is when you're walking along the streets, doing your shopping, whatever, we tend to look down, we tend to look in shop windows. I always think it's a really good idea to just stop for a moment and look up, look at the roofs, look at the chimney pots, look at the architecture at the top of buildings, but just try and take a different perspective and engage with the world around you. Try and learn something new. I think a lot of people did or had good intentions to learn something new over the course of the last 12 months. And there's an awful lot of male friends of mine who seem to have taken up baking, which I'm kind of glad that they can't get their produce to me in many cases, I suspect. And actually the last one, and what I think is probably the most important, is to give to others. We benefit far more by giving, generally speaking, than the person we give to or the people we give to. Giving is a really wonderful thing to do. So that's what we can do as individuals. And if I go back to the King's Fund research, and that research looked at numerous events across the world, such as the Christchurch earthquake in New Zealand, siege of Sarajevo, Grenfell Tower, SARS, etc. And what they picked up is that communities that are resilient fare far better, and individuals in resilient communities fare far better than people who are broken communities and isolated. So the really important thing is to keep connecting with our communities and not to leave any communities behind. So look out for those people who perhaps are more impacted, groups that are minority groups locally, and just reach out to people. I think the churches have a wonderful role that they can play in doing this. It's great to see them. Deb alluded to this. It's really wonderful to see the engagement now that we have of the faith community around population health, population well-being, and the recognition from colleagues within the NHS and local government of the role that churches have got to play as key anchor institutions in our local communities. I remain, despite a very difficult year, optimistic that we are all pulling together. We reach across, I think we're reaching across organisational structures far better than we were a couple of years ago. And I think if we can carry on the work and the collective response that we've seen to COVID over the past 12 months, we can build a future that is much better connected, that sees far fewer rates of loneliness and disconnectedness in our communities. And I think that's what we need to keep working to. And I think churches have a fulcral role to play in that. So great to be here. Really looking forward to the rest of the day. Thank you very much for your time.
Thank you, Mike. Thanks very much. It's great to hear the public health perspective there. So, and a lot in there. And I can already hear things that are going to get, I know, like the 5 ways of wellbeing that are going to be picked up later on in our morning. So that was wonderful. Thank you. So having looked at healthcare perspective, public health perspective, we are now going to go to Vernon Ross, who's going to say something about a church perspective on this. So over to you, Vernon.
Thank you, Alison. Thank you, Mike, as well. It's good to hear from you both. I'm Vernon Ross. I'm the Archdeacon for the south of the county. I do have a health service background, having been both a staff nurse and a charge nurse in the NHS and in hospices, as well as doing post-traumatic counselling post 9/11 and also with some members of the armed forces. I'm going to share my screen in the hope that this bit of technology works. So you should be able to see a robot. Yeah, can people see a robot? Good, technology works. So what can the church do to help with the mental health crisis? We're very good at warning signs in the north of England. Beware cricket balls, it's Sedbergh yesterday, red squirrel warning sign, and we're very good as well at taking our COVID tests. We're very good at pampering ourselves as well. I like cheese, so I love that sign. And I like that one outside one of our churches, reserved for the vicar, but spelt wrong. We know how to warn of physical danger, but not of mental danger. We know how to pamper our bodies, but not our minds. So what can the church do to help? Pious platitudes don't help. So don't say, keep a stiff upper lip or just keep going, because it's not going to work. C.S. Lewis wrote this in The Problem of Pain. Mental pain is less dramatic than physical pain, but it's more common and harder to bear. The frequent attempt to conceal mental pain only increases the burden. It is easier to say, my tooth is aching, than my heart is broken. Mental illness is real and we need to take it seriously. The pain and despair people feel emotionally is real. I remember listening to a member of the armed forces who came back from Afghanistan. The pain that he was feeling was real. Or listening to a healthcare professional in New York a couple of years after 9/11, still traumatized by the events of that day. And stigma surrounds mental health. It's hard to talk about it. It affects the body, the mind, and the spirit. The whole being is affected by mental health. And as a church, we need to remember it's the whole person we're dealing with. Mental health is bewildering and it's hard to understand. And it's lonely. People suffering from mental health issues feel lonely and isolated. Prior to COVID, 1 in 6 adults in the UK suffered from depression or will suffer from depression. It'll be interesting to know what the figures are after it. And it's debilitating. People with mental health issues sometimes feel quite paralyzed. So as a church, we need to show compassion and remember that it's in the Bible as well. I would argue that Elijah, Job, and David all showed signs of mental health issues. And in the Psalms, God gives us permission to vocalize acute despair in prayer. They're included in the Bible. They're part of our canon. And God is saying to us, it's okay, you can talk to me about it. And that cheery Psalm 88 ends with, darkness is my closest friend. So as a church, we can be a friend. We can offer to listen to other people. Don't be like Job's friends and offer pointless advice. Listen. Psalm 42 is a song of agony. It looks back on happier days, but not now, just the tears of desolation. The author feels cut off from God. As a church, let's use the Psalms and let's walk alongside those suffering. But later on in Psalm 42, The psalmist said, God is my rock. Paul talks about the God who comforts the downcast. If God isn't too busy to comfort the downcast, then neither should we be as a church. So as a church, we can be a person to listen, and that is a good first step. And the listener needs to have humility. It's not an instant fix. There's a real difference between physical health and mental health. It's much easier to deal with a broken leg than a broken heart. So let's not try to be a fixer, but a friend. It speaks volumes when we say to someone, we're listening. It shows them that we realize they have value. And let's remember, we're all limited. We're all flawed, but God is not. Jesus said, I came that they may have life and have it abundantly. And I think that is what we can offer as a church. We can offer Jesus in our words, in our actions, in the time we take to share ourselves with others. So what can the church do to help? Well, we can get alongside people. We see that pattern in nature. These two ducks are actually swimming across a bridge. It's so much flooding, the river has broken its banks. And birds in murmurations, flying together, getting alongside each other, helping each other. The journey can be easier. The journey can be easier when someone comes with you. And it wouldn't be a church thing without recommending a couple of books. So these are two books. I'm sure most of you've read The Problem of Pain. It's worth rereading. And the other one is from Mark Meynell, When Darkness Seems My Closest Friend. It's a really honest reflection of being a Christian in ministry and suffering with acute depression. It's worth reading. Thank you. I think that's within my 5 minutes.
Thank you. Thanks very much, Vernon. So yeah, what we're going to do now is we're beginning to think about what the church can do to help with this and respond to this. We also, I guess, need to start by thinking, well, where are we starting from? And we're going to go into our first breakout rooms. This is the first of two. And this is going to be a chance just to chat with one another about what's it like where you are. This breakout room is going to be done randomly. The one later this morning will be done in geographical area. So this you're going to chat to anyone. They might live at the other side of the county to you. What's it like where you are? What resonates from what Deb and what Mike and Vernon has said? Where have you seen the listening? Have you felt listened to? I also feel really aware that whilst we seek as church, and it's similar in the NHS, to support others, that actually we as NHS workers and as you as clergy have mental health of our own as well. And that's really important to acknowledge. So what's it like where you are? How are things going? So thank you so much, Vernon, Deb and Mike. And if Sarah could do the magic and put us into our breakout rooms, it's 15 minutes and then we shall regather. Hope that was a good time. Certainly in our group, I think we could have chatted for a long time, actually. It's really good to connect up with others and hear what things have been like and what they're experiencing and observing. Alan's going to put a comment in the chat. It must be, we're waiting for it, we're ready for it. So
no, he just ran out of time. He'd only got 5 seconds and he realised that it was going to take longer than that.
Oh, okay. So brilliant, super. We do get another breakout room later, which is great, because one of the things about this morning is we're hoping we'll have time to chat to one another as well as hear about some things. So now we're going to move into our second set of mini presentations, 3 again. And these 3 come from things that have been happening in Carlisle Diocese. So we're going to be doing CTIC things later on. And this little 3, yeah, can people hear me?
Yes. I can hear you.
Christy's just
Yep.
put, are we meant to be able to hear anything? Yes, Simon, there will be a break. In 15 minutes, we're having a comfort break. And we'll have been on Zoom just over an hour there. So yes, there will. Though if you're desperate, go now and come back. So we're going to have hear about 3 things that have been happening in different parts of the county within Anglican Diocesan churches. And first of all, we're going to hear from Ramin, and Ramin is a mental health first aid trainer. I'll let him introduce himself, where he is from, etc. So over to you, Ramin.
All right, wonderful. Thank you very much. It's great to be with you all. A real privilege to join you today. And we just had a great time during our little session that we did then, talking about what's happening on the ground and what our experience is. And I've taken lots of notes to feedback later. Most of you don't know me. My name is Ramin. I attend St. Thomas's Church in Kendal. And we've been attending there for a couple of years. Before that, we were involved in missionary work over in the United States, and also been a pastor of a couple of small churches over here in England. I worked for the Luis Palau Association as well as an evangelist. So kind of been involved in church work for a number of years, but I also have my own business called Cornerstone. And one of the things that is right at the heart of what we do is around mental health and mental health training, primarily through Mental Health First Aid England. So what we do is we train people to be signed off as mental health first aiders. So in order to visualize that, if you think of a physical first aider, we're all very familiar with that principle, and we'll have people that are physical first aiders in our churches. What we can also do, particularly important at this time, is train our people and be trained ourselves to be mental health first aiders. So you're not trained to be a practitioner, you're trained to be the person that stands in the gap and can identify things early and signpost people to the need that they have. Now, amongst what I've also done is I ran an 8-week webinar series for Gateway Church here in Kendal around a whole raft of different subjects around mental health, and also did a one session series with our church body at St. Thomas's around mental health and managing our own mental health. And one of the people in the congregation came to me and said, sent me an email, said that it had been really, really helpful for her in terms of understanding how she can take better care of herself, but also understanding what she's seeing in other people. And I guess ultimately my heart is this, is that we within the church need to be better equipped when it comes to mental health and looking after ourselves and looking after one another. And self-care has already been mentioned here, but one of the things that's really close to my heart is that if you and we as leaders are not taking good care of our own mental health, then we cannot be much good to our churches and to the people that we have responsibility over. The picture is of somebody in an aeroplane, and most of us been in an aeroplane, and when we're advised very much at the start is when that max oxygen mask drops, put it on yourself first before you take care of everyone else. Because if you're not taking on oxygen yourself, you're not much good for anyone else. And I think that we as leaders need to take hold of that truth, that if we aren't taking care of our own mental health first, then we will not be able to take care of other people adequately. So there's 2 main elements of what I tend to talk to people about is self-care, and I know it's been tough for you as leaders. And then second thing is, how do I identify problems in other people and then to act early? Now, the Mental Health First Aid is an accredited program, And I'm qualified to train that. So I train people to become first aiders. And then you would be certified as a mental health first aider within your context and with your congregation. And as a result of that, you'd then be able to do these things, which is understand the important factors affecting mental ill health, identify signs and symptoms for a range of mental health conditions, use various protocols to be able to engage people, talk about how we listen non-judgmentally when engaging conversations around mental ill health, and also signposting, what do we do then? But one thing's absolutely clear is that we need to learn the language of mental ill health. We need to learn how to start having those conversations and not be paralyzed with fear around this subject. And I think there is a big place for the church in the coming weeks, months, and years to be real hubs of love and life and support in our communities, and be able to stand in this gap with confidence for the people that we are called to serve and walk alongside. So self-care and care for others are right at the heart of kind of what really moves me. And I think that there is great scope for us as a church, and actually a huge opportunity for us to step into. So that's all I have to say for now. Thank you.
Thanks very much, Raman. Thank you. And yeah, so some of you will probably have twigged that Raman and I go to the same church, because I'm also a member of St Thomas's in Kendal. And I went to the evening session he did on Zoom for St Thomas's, and I was really impressed with it. I just think this idea of mental health first aid is great, that, you know, obviously I'm a doctor, but you can't become doctors, and that isn't what you should try to become. But we can increase both our awareness of mental health first aid. Just sounds perfect for that standing in the gap for self-care, and also being able to listen well to others and know when to signpost on and how and where. So I just thought it was great what I heard from Raman that evening, and wanted to share it with you. So we are now going to go up to Appleby area, and Christy, Christy, tell us about mental health cafes and introduce yourself, because I haven't. Thanks.
Hi, I'm Christy Patmore. I'm a pioneer minister in the heart of Westmoreland Mission Community, which is kind of Appleby Deanery and the Methodist circuit here. We have, since November, been doing something called Renew Wellbeing Cafes. A Renew Wellbeing Cafe is a place where it's okay to be not okay. It's a place just to come and hang out, to form friendships, to do hobbies together, and there's not much more agenda than that, really. The three key things about this Renew Wellbeing Cafe is that we aim to be present, which means we turn up and we are there for people. We want to be prayerful, and I'll explain more about that in a minute. And we want to be in partnership. Being in partnership means we're in partnership with, mainly it comes from the local church, but we're in partnership with local mental health services, GPs, with possibly businesses in the community if it's taking place in an actual cafe or a community centre, and with the people. It's very much a level playing field. So we're not a group of people who are all sorted with our mental and emotional health, helping other people. The phrase that's often used is we're all human together. We all have our ups and downs. We all have our times when we're feeling absolutely great, and our times when we're feeling maybe depressed or anxious. Some people have more serious mental health problems, but we're not there to fix people. We're there to provide this space where we can connect with each other, and we can enjoy hobbies, we can listen to each other, we can pray with each other. Very much based on the 5 ways to wellbeing that were mentioned earlier. So we might be learning new skills. Someone might come into the cafe as a as someone who's not on the team, but we call them regulars, and they might teach someone else there how to knit, or how to garden, or how to do some woodwork, all sorts of things. I said we started in November. We started temporarily on Zoom, thinking that was really very second best and probably wouldn't work very well. We found, to our surprise, it's actually worked really well, that people have enjoyed coming. Even people who say that they don't like Zoom, don't tend to like it for formal meetings, have found that in the Renew Wellbeing Cafe, it's fun, it's fine. We say to people, you don't have to join in with the conversation. You can mute yourself, you can turn your camera off if you want, and just be there with other people. Obviously, some people enjoy talking as well, and so they join in with that. The prayerful bit is that it's all based around a rhythm of prayer. So we're not just any old coffee morning. We are a Christian community, although we welcome people of all faiths and none. And the idea is, in the physical space, we're going to have an actual area, or it could be a separate room, which is set up as a prayer space, where we go to 2 or 3 times during the time, just for 5 minutes of very gentle meditative prayer, often based on the Psalms, which Vernon was talking about before, and not praying necessarily for people, but coming together into the presence of God and seeing what God can actually do in people's lives in that way. But the prayer is totally optional. So if people want to carry on with their hobbies or with their conversations, that's fine. And we would leave a member of the team there with people who don't want to join in, so they don't feel that's a problem. But everybody is welcome. Obviously, that's not been quite so easy to do on Zoom, because we could do breakout rooms, but it hasn't really worked for us. So what we've said to people is, we're going to pray at the beginning and the end. Feel free to log on a bit later and to leave earlier if you don't want to join in with the prayer times, or you could just leave your screen on and go and make a cup of coffee while we're praying. There's no pressure to join in. But what we've actually found is that so far everybody has joined in, and we're not all Christians. You know, there are people there who say they don't have a faith, but they actually enjoy that quiet time just to sit. And I opened my eyes the other day when I was leading and looked around the screen, and I could see that people were really focusing, actually really in the zone, including the people who would say that they're not Christians, they don't have a faith in God, but they somehow God was meeting with them. I believe in that, and they were engaging with it. So I'm a big advocate of Renew Wellbeing Cafe, happy to talk to anyone about it. We're hoping to start our first physical space at the new cricket club in Appleby that was built after the floods. And it's a really fantastic space, and the cricket club are partnering with us because they're just letting us have it for cost, for a very, very low rent. So we're really looking forward to opening there. But my vision is to have them certainly all over our mission community in different villages. But I'm also really happy to talk to anyone who wants to explore it for their area and to help you. There is some central training. It was started by a lady called Ruth Rice in Nottingham, and it's just kind of grown organically from there. But they provide training and a structure for you to have a look at. But really, it's very simple. And actually, most people who come and help also come because they find it to be a helpful space for their well-being. So it's not one of those things that people feel hugely pressured about. They just enjoy coming along. Hope that's kind of explained it to you.
Thank you, Christy. Thanks very much. I did the Renew Wellbeing online training with Christy's crew, and it was really excellent. And I have hung out at 1 or 2 of them. Some of them involved cakes.
Oh yes, yeah.
Screen. That was great, wasn't it? We did Christmas cakes in November. We did, and the thing that struck me about it is it's phenomenally simple, and yet so welcoming to the community and so effective. So already there are more new Renew Wellbeing cafes happening, including one over on the West Coast where Julia is, and Julia, well, Christy's crew as well, and also Julia have also done something called the Sanctuary Mental Health course. So we're going to go over to Julia now to introduce herself and tell us about Sanctuary Mental Health course, and then we'll be having a comfort break.
Thank you. So I'm Julia Powley. I'm the Vicar of Harrington and Dissington, and as Christy said, as Alison said as well, what a lot of this actually came from is we've had a little prayer group going through the healing team across the diocese, just a very small group of us, and a lot of this stuff has come from there. So we wanted to set up a Renew Wellbeing cafe, which we have done in Harrington, and the Renew Wellbeing advise that it's good to do a little bit of training, particularly on the mental health side, and they recommend the Sanctuary course. Now, the Sanctuary course comes out of Canada. It's normally a course which you have to pay for. However, during the pandemic, they made it free. So all you need to do is register. And the Renew Wellbeing folk put on they facilitated a couple of these courses over the north of England, but I couldn't do either of the times. And so what I did was I facilitated one myself for our team. So 5 of us did this Sanctuary course. The Sanctuary course was set up by 2 ministers, and what they said it was it was in order to equip the church to make a difference in the lives of individuals struggling with mental health problems and to promote mental wellness. It's an 8-week course, 8 sessions. And on each session, they look at 3 perspectives. They look at a psychological perspective on mental well-being, they look at a social perspective, and they look at a theological perspective. And the whole thing is there are very good notes, participant guidelines and everything. We didn't follow them exactly. We kind of did it our own way, which is what I tend to do. But in the middle of them all, there was a video, 10 minutes. And in that video, there was a bit of testimony, a bit of discussion among Christian leaders when it became obvious as time went on that they had all dealt with mental health issues themselves. And then there was a theological bit at the end, which was actually from a professor of divinity at the University of Aberdeen. The sessions there was an introduction. When we did the introduction, we actually thought, goodness, this is really lightweight, but it changed in week 2. So you cope with the introduction. The second week is about mental health. The third week is mental illness. That is the heavy week. The testimony that week was a young woman, a priest in the church in Canada, whose husband had taken his own life. And it was really, it was just heavy because it took you into the darkest of places. The 4th session was on stigma, the 5th on recovery, the 6th was companionship, the 7th is all about self-care, and the 8th is the church. Now, what they are very determined that everybody knows is that this is not to make any church leader a mental health expert. They are very keen right through to say we are not experts in mental health, nor should we be, and it would be really dangerous if we even attempted it. What they want the church to do is to create community and to accompany people, to be places where that stigma goes, where people know that they're safe and that they know that they're accepted. Was it good for us? I think it was really good for us. The 5 people who did it, there were two of us who were clergy, a reader and a member of each congregation. One of the members of one of the congregations wasn't very keen at first, but by the end she said she was really, really pleased that she'd done it. I think what we gained from doing it just as the 2 parishes was probably an ability to be totally honest and to discuss things from our point of view. So, for example, welcome. What does welcome actually look like? We talk so much about welcome in church. What does that, is that just the person on the door who says good morning? What is welcome? And we were able to look at what does welcome look like in our two churches, and we were able to talk about failures and what we wanted to do about that. And I think over the course of the 8 weeks, most of us, I think different sessions struck different ones of us and churned up things for us ourselves as well, which we were able to sort of work through by ourselves or with somebody else afterwards. I would highly recommend this course. It must be easy to facilitate if I manage to do it. All the stuff's there, and it's very well worth, as I say, very specifically to say we are not mental health experts, but very specifically to say as church we have a huge role to play here. We can create that community, we can create proper welcome, and we can work against some of the stigma stuff.
Thank you, Julia. I think this course is pitched really well of really being a great space to explore mental health as a church over 8 weeks, and yet being very explicit about not becoming an expert or trying to be an expert, but just being more aware and better equipped. Right, we are going to have a comfort break for 5 minutes. Sarah's going to put some background music on. My clock says 11:24, so if we say 11:20, let's come back at 11:29, and then we'll actually come back at 11:30, won't we? Yes, good idea. Putting that makes me want to have coffee and cake now. So, right, see you all in 5. Just see if we've got people back. It's always risky, isn't it? Sending everyone off for a break. You kind of wonder how many people are going to come back. Quite a few of you have. That's very encouraging. So brilliant. Right. Now for our final set of 3. We're going to be hearing from churches together in Cumbria and some of the things that have been happening in their area. So we're going to start with going back to Andrew, who's going to talk to us about self-harm and suicide awareness with the organisation SAFA. So over to you, Andrew.
Right. Am I on? Good morning, everybody.
Morning.
This initiative, in the sense of my own, arose out of an engagement we had with the MPs, which Vernon set up. And engaging with the MPs in Cumbria, the issue, and there was a sharing session after the MPs had gone, and it was quite clear. I think a vicar shared that she had done 9 funerals related to suicide in the very recent past, and within the last week she had had contact from a mother whose daughter had attempted suicide and wanted help, and was told, yes, you can have some help in 18 months' time. And around the screen, about 25 attendees, there were a number of nods. And that alerted me to the fact that as clergy people, and particularly within the Anglican communion, you may be faced with these sorts of issues. And it provoked something in me in relation to the role of churches together in Cumbria. It provoked me into action. that action was to contact the organisation with which I worked when I trained in Gestalt psychotherapy, called SAFER. And since my training with them, I've become a member of BACP and do counselling work through Cedar House out of Ambleside. But it provoked me into an action to reach out from myself as an individual, but also as a representative of the church with a big C. And in doing so, I'm actually taking up the motif very much of Churches Together in Cumbria, which is to engage and interface with the organisations which are out there and working in our communities. We have worked with asylum seekers, we've done work with domestic violence, and Catherine Froggatt will speak shortly. But we've done, in relation to the Anna chaplaincy, but we've done work on dementia and the like. And it's this interface with other organisations and the county out there. So I contacted SAFA, S-A-F-A, because I've kept my links with them. And they were creating an online toolbox. SAFER is an agency which works mainly with young people, but when I worked there, I was working with adults who were returning to self-harm, and the waiting list for people to engage was over 300 people. So they had they were creating a toolbox, online toolbox for mental health, and I'll get the link and I'll get it sent out to you. But I went to them and I said, have you got any input here in relation to faith, communities of faith? And they said no. So I had an engagement with the creator of the toolbox for about 3 hours. He videoed me on interview, and on the toolbox there is now a box which you can click which says take a walk with your faith. I was on the opening session of the SAFER toolbox, and there were 65 people from various voluntary and statutory organisations in particular, and my clip was shown, and it had one heck of a reaction from many people, not least a young man whose clip was also on the toolbox, who at the age of 16 came out with his sexuality and struggled with his faith. So that's an example of the church, churches together, working together, reaching out to non-church organisations and making partnership with them, as Churches Together have done on a number of occasions. And I think what I'm seeking to express is that outward looking, that if we have a theology of the kingdom of God, and God is working, God isn't working just through the church, God is working in God's world. And where we see signs of and actions of grace and the character of Christ, then we can go with those things and we can support them. And it's been absolutely fascinating to see the reaction to not only my piece, but the engagement that I've had with individuals in relation to faith and mental health. So that's just an example. I'll send the link out. It's SAFA, S-A-F-A, and it's working across the whole of Cumbria in relation to self-harm and mental health, particularly in young people. So I'll close that there. Thank you. Oh, it's there on the chat. Yeah.
Thanks very much, Andrew. Yes, and I think it's great that we can in church have awareness of the organisations that are around that people can refer and self-refer into. Some people may feel that they've been called to connect into that, like Andrew has, and for others it may be knowing what's out there and what's around. In my work as a doctor, I have referred to SAFER numerous times, and they have been excellent. They also do some really good work in the area of eating disorders, and there's not much in the county on eating disorders, and they've got good stuff on it and on their website as well. So thank you so much, Andrew. We are now going to go up to Carlisle to David, and David is going to tell us about, we're going to start picking up the theme of bereavement again, which has been so heightened in so many ways through COVID and the mental health impact of that. So over to you, David.
Thank you very much. It's a privilege to be able to speak to you. I'm a late substitute, so I'm jogging onto the pitch, as it were, in place of Shelagh Goldie, who sadly hasn't been at all well. Many of you know Shelagh, and I hope you will pray for her at this time. I'm Church of Scotland minister in Carlisle and Longtown, and I used to be the chair of the Social Responsibility Forum of Churches Together in Cumbria, and Shelagh was the officer. We're both actually recently stood down, but we're still involved in something called the bereavement journey in the county, which we feel is a very practical, simple and strengthening response to the bereavement crisis that we are facing. Of course, bereavement is an everyday experience for people. And I'm about to leave this computer to go and visit a lady who lost her son age 60 from a heart attack yesterday. And you will know that in your ministries. But the pandemic has brought all of us perhaps a more acute experience of bereavement, in the sense that it's touched all our lives. I've lost an aunt in America, and I've lost a father-in-law. The aunt died of cancer, and that condition was probably not picked up because of COVID. And my father-in-law did have a COVID positive test, although he was very frail with other conditions. You also probably had more funerals, or some very particularly difficult and distressing funerals. People have not been able to say goodbye to their loved ones easily. They haven't had the support of their loved ones round about them in the aftermath of their loss. Funerals have obviously been reduced in number, and also people who had to wear masks couldn't sing. So everything has been really, really challenging. And although we were a social justice forum, we felt we had to find something that we could offer in a very immediate sense to people at their point of need. And we heard about the bereavement journey, and it's a lovely gift to the church. It comes from Holy Trinity Brompton, which has given the Christian community in this country so many blessings, I think. But it is now independent from Holy Trinity Brompton. The lady who presents the course, Jane Wiegand, is a lovely, gentle and sensitive lady who's been through the loss of a child herself. So she has that sympathy. And it is a model that is workable online. It wasn't originally done online. It was done in small groups, usually in church buildings, but it's not exclusively done by Christians. But it has been done effectively online in recent months. So Sheila and I did some research. We actually entered some of the national training, and we had our first course in September, and Churches Together has now done 3 courses, and the third of which actually is taking place this afternoon. The bereavement journey is for anyone bereaved in any way at any time. So it's not just about COVID-related loss. And many of the people that have come on the course, they lost somebody long before the COVID crisis. The course gently guides bereaved people through the most common aspects of grief, enabling them to process the implications for themselves and to discern the next steps. There's 5 sections to the course that could be used in any context, because they're not specifically Christian. Looking at loss, the pain of grief, how it feels, the pain of grief, how to deal with it, coping with change, and moving forward. And there is a 6th optional section of faith questions which people can attend if they so choose. It runs for 2 hours. It has 2 film talks which Jane presents, and in between there are group discussion times, and these can be very touching and moving and meaningful. They have to be handled obviously very sensitively. It doesn't have to be a minister or a vicar or whatever that leads them. We've trained up people with a sensitivity, a listening ear to share in the leadership of the groups. We suggest only 8 guests in the group with 2 group leaders. It has to be very carefully organized in the sense that you don't want to do something like this in a haphazard way, and it's worth possibly having a technical expert that can do all the technical side of it. And it's also worth having somebody in the background who is a trained counsellor who can support the people on the course. While we have done it and tried to initiate it within the county, we encouraging individual congregations to consider doing it, or groups of congregations, mission communities, churches together groups to do the course in the coming months. There'll be a continued need, I think, and it may be that you'll be able to do them in your church halls in person. You can find more information at thebereavementjourney.org. You can watch the videos yourself, which I think is important to do, and you may well find yourself very touched, moved and comforted by them. And there's also a practical resource website called ataloss.org associated with the course or with the general theme of a Christian response to bereavement, ataloss.org. And you can find out more. North Cumbria Methodist District are hoping to start a course next Monday, and they've had very few responses. So if you know somebody in your church who you feel would benefit from this, please could you let me know or through Alison, and we can involve them in that course. And it may be worth you as a leader in the church doing the course so that you're enabled to give a lead in at a future course. So I commend it to you. I think it's this is one thing the Christian church can do very positively and in a sensitive way. I think it will be a rich blessing and to people throughout the county and beyond. So thank you, Alison, for letting me share.
Unmute myself. That's the first time I've done it in the wrong place. Thank you very much, David. And yeah, the bereavement journey, the clips of it that I've seen online it really is beautifully and gently done, and such an important area at this time. Always an important area, but has become magnified during the time of COVID. Thank you. So now we are going to move into the final bit of our presentations of 3. With COVID, the top 3 things which have been an issue are mental health. In terms of health, there's all the economic stuff, of course, but in terms of health, mental health, bereavement, and social isolation. And social isolation has been across the board, and also perhaps particularly poignant for our shielding population and our elderly population, and older adults who've been hiding behind their doors and wondering even now whether it's safe to come out again, and want to possibly have, got rather nervous about life and going out again, is a really important area, and the impact it has on them and their mental health and their families. So I'm delighted that we have Catherine Froggatt from Anna Chaplaincy with us. So Catherine, over to you.
Okay, thank you, and thank you for this invitation just to come and very briefly talk about Anna chaplaincy. I'm aware a number of people here have already heard me talk in other contexts, so hopefully this won't be too repetitive. And I'm also very pleased that we've got Margaret Tate here, who is one of our Anna chaplains working down in Low Furness. That's great, and other people who are hosting Anna chaplains present as well. So my name is Catherine Froggatt, and I'm the Anna chaplaincy lead for Cumbria, working for Churches Together in Cumbria on a 2-year project which started last autumn. And Anna chaplaincy, so named after Anna, as in Simeon and Anna, an older woman who encountered Jesus and recognized who he was and what he would bring, is a national project, a national movement based with Bible Reading Fellowship, and it is aiming to establish and resource the spiritual journey of older people by offering them spiritual support wherever it is that they live and whatever the extent of their faith, be it strong, little or no faith, just to be alongside and accompanying. And Churches Together in Cumbria have money for 2 years to employ me as a kind of development project manager, help get this started in Cumbria. And so how are we going to do this? Well, the first thing I need to say is that we're actually building on what's already happening. This isn't something new. This isn't a new initiative. This is actually an affirmation and a confirming of what's already happening. That's partly through the 5 years of the dementia project that finished last autumn, which has set up dementia enablers in many churches across Cumbria. But also recognizing that within many churches and most churches, there will be people with a concern for older people and are coming alongside them and supporting them pastorally and spiritually. And Anna chaplaincy is a way really of bringing that together and coordinating it, I think possibly more effectively, and we can also give some resource to that. So we will do this by creating a network of volunteer Anna chaplains, Anna friends who work alongside them, and other volunteers to support older people. Anna chaplains are working not only within churches, but working out in the community. They are looking at what's happening, looking at where activity is happening, where older people are and coming alongside them, but also looking where the gaps are and seeing where we can fill a gap. And I think Alison indicating the issue around social isolation is really, really key. We hear stories and have Anna chaplains that I know of, not just in Cumbria, know of people who have not left their house or their flat since last March. And that's a big step to suddenly come out when you've been looking after yourself. And so I think there's a lot of fear and a lot of anxiety that people will need to come alongside. How Anna chaplaincy looks in any locality will vary. So we have, and that will reflect the skills and the experiences of Anna chaplains who can be lay people or ordained. They have varying backgrounds in health, in education. They may have theological and pastoral backgrounds as well, but it also has to match the context where they're working. So for example, in the East of Eden mission community, our Anna chaplain is primarily doing telephone befriending. Whereas when we look at Anna chaplaincy down in Barrow, they're doing a lot of work and have been with care homes and supporting staff and residents in there with spiritual resources to keep them going. And obviously, as things open up, they will be back in there. So we currently have 5 individuals who are working as Anna chaplains or equivalent roles across Cumbria, people who've come forward and have been licensed by the Bible Reading Fellowship. And they're working in Barrow, Low Furness, Kendal, East of Eden, Mission Community, and we have a distinctive deacon with an interest in older people working in Kirkby Lonsdale. We're currently running a 6-week Exploring Anna chaplaincy course. In total, we have 18 people on it. So I'm anticipating that there will be more Anna chaplains and Anna friends coming through that as they work through and understand what Anna chaplaincy is and discerning for themselves if that is the way forward. So I guess I'm here for the next 18 months. I'm a resource. I'm here to help support individuals and communities and churches and mission communities to look at how we can initiate Anna chaplaincy if that is appropriate for your locality. There are resources available. As I say, we're running this current training course. We'll probably run it again in the autumn. We have a conference that will be held in September, and I'm available to have conversations and to help support and take that forward. Thanks.
Thanks very much, Catherine, for that. and it's such an important area for serving and blessing our older adults in the communities and what they have experienced recently. Thank you. Thanks for coming, Gordon. Goodbye. We are running slightly behind. We've got the Zoom facility booked to 12:30. I think we'll probably finish about between 20 past and past. So we are now going to go into our breakout rooms again, and this is done in a geographical area. If you're in Kendal and you're not seeing someone you thought you would see, that's because there are 2 breakout rooms for Kendal. Other areas, there's one, so you'll probably see the people you're expecting. And in this breakout room, it's an opportunity really just to chat together about what is bubbling up in your area where you are. Do any of these things you've heard about sound interesting, you think would be useful for your community? And also, are there other things going on that you can share with us and tell us about? We would love to hear about them. So once again, there'll be a speaker in each of the breakout rooms. So thank you, Sarah, if you can send us forth. Thank you.
My day job is I am the CEO of the Guild of Health in St. Raphael, which is a charity that's been focused on the Christian healing ministry for over 100 years. And we've always worked in conversation with medical science, with psychological science. So we've always taken a holistic view of what it means to be human, and a holistic view of what it means to connect together faith and health. My background is I'm an Anglican priest. I'm a scientist, so my research background is in physics, and I'm a cancer survivor as well. So I often talk about health, sometimes with my professional, theological, sciencey kind of hats on, but also from a personal point of view as well.
Thank you. And we're up here in Cumbria, you're in Lichfield, but your work is all over the UK, it's into Scotland as well, isn't it? And so you have this national view that I guess is bigger than the county view that we have. What are you seeing? What are you observing in your national role?
It's interesting, Alison. It's so the Guild's an ecumenical charity, so we work with not all the churches, but as many church denominations as we can. And I spend a lot of my time talking about the healing ministry, and not just with church leaders, but with, in inverted commas, ordinary Christians. And I try very hard whenever I get the chance to speak to people who don't go to church, because if you run a church, you want to know what people who don't go to church think about church and about all sorts of things. So that's a mission field. And so it's fascinating. I mean, I was just saying to somebody earlier, you know, if you haven't had a mental health wobble over the last year, if we're honest, then maybe you haven't been paying attention to what's going on. It's been such an extraordinarily huge event in all of our lives. And recent stats coming out saying that over half of Britons have said their mental health has deteriorated, over half. And that's the ones who were prepared to say anything about it. With more younger people reporting an impact than the older generations. And almost all Britons, most Britons, have experienced some kind of anxiety since the outbreak of it all. So it's been an enormous mental health breakdown. And talking to church, particularly church leaders, I get a sense of the enormous exhaustion of what we've been going through. And I have wonderings now around, as we begin to come out of lockdown, what's been going on behind all these doors? What are the stories we haven't been sharing? What have we been keeping inside? So there's a sense that, yes, we've been through something really difficult. There's an impact on our mental health. But as we look forward, there's a lot of things that are about to come into the light, I think, and we've got a chance to respond to that as a church. But also nationally, the church, I think, has been recognised by public health, by local councils, as being extremely responsive, from their perspective, surprisingly responsive to the needs of the community. So actually nationally, the church and church leaders and church communities are being recognised for what they've done over the last year. And so then I'm always a glass half full kind of person. There is opportunities ahead for the church.
Wonderful. And how do you think the church can help with this, and specifically healthy healing hubs, which I know is a project you're developing?
Yeah. So how can the church, people, and it's not just, you know, it's it's not the buildings, right? It's the people. How can the church, how can the people of faith help with this mental health impact we've all been experiencing? Well, the first thing I think to say is there's an awful lot of professionals. Alison, you're one of them. There's also a lot of people who are professionally trained in mental health response. So let's not get in the way of people who are already helping. I think the church can do a hugely important job, but we mustn't be recreating the wheel, reinventing the wheel. Okay, there's an awful lot of stuff there happening already. So I think the role of the church is very clear. It's not to reinvent the wheel. We can signpost. So find out what's going on in your local community, find out from the GP, find out what other projects are going on, and connect in as far as possible for yourself. I think it's really important for Christians to model good self-care. We need to normalize that we have to look after our own mental health. As we might go to the doctors when something's wrong with our bodies, we go to the doctors when something's wrong with our minds. If we're having mental health problems, we have to model good self-care, because there's so much taboo around mental health problems. And I know myself, when I've stood up in front of large groups, I think I was up speaking about clergy well-being in Carlisle Diocese a couple of years ago, and I myself struggled with depression after my second child. As I wasn't a vicar, I was married to a vicar, even more issues. Stood up and said, I struggled, and then something was released in the room, and people came up either publicly or privately, said, I've had trouble, and I think there's something about let's talk about our own struggles appropriately in a well-boundary kind of way, because it helps other people talk about it. So the signpost and this modeling. But on a deeper level, I think we need to have confidence in what the church does offer. We offer something really vital right now that our communities are desperate for. We offer space. We offer time. We offer saying, how are you? And actually, blimmin' well, listening to the answer. I found myself meeting friends or people, family that I haven't seen in the last year. You sort of say, hi, how are you? And you think, what a stupid, how do you summarize what we've been through? But could our churches be places where we actually listen to that answer? Have a cup of tea with people. It's almost a cliche, but right now, that's what people need. They need space to be listened to. They need space to rage. They need space to cry. They need space to grieve. And we can offer that to people. We can also offer to people support about having the conversation. I do a lot of training about the health and healing ministry, and often what people want is they want to know how to pray for people to get better, because we do it every Sunday. We have that list, right? The same list every Sunday. We pray for people. That's what we do. People are underconfident sometimes about having the conversations. They meet Joe Bloggs in the street. How are you? There's a fear about asking that question, because what if Joe Bloggs tells you how it really is? And then you're burdened with Joe Blogg stuff, right? But we're Christians. We can pray about it and give it to God. We don't have to carry around Joe Bloggs' burden all day. Maybe people need help reminding of that process. So the Healthy Healing Hub project is about helping churches to become hubs for healing for the whole community. And we've piloted it. We've talked to lots of people over a few years about how to help churches become hubs for healing. And where we begin in the course is a 3-part course, 3 tiers, bronze, silver, and gold. The first tier, the bronze tier, we help people get back to basics. So let's talk about, what do we mean by healing? When we say, can I pray for you? What do we think is going to happen? We look at the history of that. The last 2,000 years, we've got a huge history in health and healing. So let's look at that. Let's look at our theology. Let's look at good practice. And all that does is raise our confidence, because in the Guild of Health, particularly with the Healthy Healing Hub project, I believe the church has got a key part to play in helping people recover from the pandemic. And we're being recognised, as I said before, externally, like by councils, but by public health officials, by NHS doctors who want to do social prescribing. We can offer real health and healing in the community, and the Healthy Healing Hub project helps you get some training in that. So I've just stuck a bit on chat. I hope that's okay, Alison.
Yeah.
So our next training course is cohort 4. All the first 3 ones sold out fairly quickly. The Go Health community. This is a resourcing community for Christians who are interested in connecting faith and health, and we give you a bundle of resources every month. So I've just released a prayer for India, a little meditation film, some blog posts, and other online training resources as part of the Go Health community. We also have a podcast which is free for everyone as well. So I put some links up there, and I'll also just type in my email address because I know we're short on time. If anyone's got any questions about any of this, then this is me, and I'm very happy to answer any questions.
Thank you, and we will also send those links out afterwards as well. Sarah's copy and pasting all the chat. So brilliant. Yes, thank you. Thanks very much. And I'm really excited about this Healthy Healing Hub project. I know we have one church already booked onto your next training starting in a few weeks, and 4 other churches across the diocese who have already expressed interest. And I love the idea that within the Healthy Healing Hub project, that we can have the diversity of it looking different in different places for the context of that church and that community, and also have this unity of being part of something together, Healthy Healing Hubs, which is recognised in a way that we can also approach local GPs and primary care networks and ICCs, and I could go on with abbreviations and I won't, but the people you need to get into basically. Yes. So thank you so much for coming, Gillian. We really do appreciate it.
Thank you for having me.
You're welcome. So we are now drawing towards the end of our time together, and we will be sending out an email after with various bits on links and so on, and what would you like next, what would be helpful, and anything else you want to say. So now I'll just hand back to Bishop James. Thank you.
Thank you, Alison. I'm conscious from what you said earlier that I could well be cut off in my prime, so I'll be as brief as I possibly can to stay within the Zoom limits. It's been an incredibly rich and worthwhile morning. I mean, it's raced by. I couldn't believe that 2 hours had gone by, and I've got pages and pages of notes that I've been taking. So thanks to all the contributors who've been uniformly excellent, and to everybody who's taken part in this webinar for sharing your own experience, which certainly in the groups I've taken part in has been absolutely fascinating. And particular thanks, I think, to Alison, who's guided us so brilliantly through the programme and given us a lovely commentary. Alison, if you ever decide to leave your current day job, there will always be a place for you as a wonderful TV presenter or newscaster or continuity person. And I think your sensitive ministry today has been a healing experience in itself. So thank you very much for that. Several important themes have emerged from the various presentations we've heard and the various conversations in which we've all engaged. I'll just mention a few of them. I mean, there are a dozen. I've written down about 20, but there are a few that I just want to highlight without repeating everything. First of all, the value of being alongside people who have mental health issues. And we've talked about the loneliness of mental illness, which can be very, very acute indeed. And connected with that, the value of listening. I once read that giving somebody one's careful and close attention is the greatest gift we can provide or offer. We were just hearing from Gillian about offering space and time and simply our own presence. And that's one of the best things we can be doing, I think, for others who are struggling at the moment. We've been reminded that we're not expected to become experts ourselves, but we can begin with help to recognize signs and signpost and refer others and simply be with them as they go through their own difficulties. And connected with that, several people have talked about the importance of caring for ourselves, which is so necessary if we're to care for others, and not being afraid to seek help when it's needed. Gillian talked about being models of good self-care, and that's so important. And being prepared also to care for the carers, particularly people who've been looking after relatives with dementia and so on, who have been having a very difficult time during COVID. I remember once reading that the key to happiness is giving and serving others. That's a theme that has emerged quite a lot. And we've heard about people's fears of getting out again. So many people who haven't actually left their house, it's hard to imagine, for a whole year, and are really fearful of social interaction, and our need to enable them. It's a bit of a hidden problem. And so the part of the question is how we can discover who is suffering in that way and how we can best help them. We've been introduced to quite a number of resources which are simple and accessible, and that includes courses, materials, and various ministries like Anna Chaplaincy that are available. And to conclude, we've been reminded, I think, of the vital importance of connection and relationship. What the kingdom of God is all about, connection and relationship with God, as well as with each other. And there's the huge challenge for us in these coming months, and for the whole of the church, how we can enable true community, how we can build the kingdom of God, how we can be alongside people and help them to connect with God as well as with us. So let's conclude with a prayer and our grateful thanks to everyone who's been involved today. Father, we thank you for everything that we've heard and everything that we've discussed and been able to think about this morning. We pray for all those who are struggling with their mental health at the moment, for those who are very ill and for those who just are confused, anxious, and depressed. And we ask for sensitivity ourselves to recognize signs when we see them. We pray that help will be forthcoming, and we pray that we ourselves will be agents and instruments of your healing as we stand alongside people and as we listen carefully and attentively to what they may have to say. We pray, Lord, for ourselves, and thank you for the reminder that we need to care for ourselves as you care for us, so that we can indeed be channels of your peace and your love to those around us. And we pray for your church and all our various denominations, our ecumenical work together in our mission communities across the county, asking, Lord, that you'll take us and that you will use us to bring about fresh connection with one another in fellowship, and above all with you as our Creator, our Redeemer, and our Lord. And we commit ourselves to you with this challenge in our minds and with the knowledge that by ourselves it all seems too much, but with you everything is possible. And we pray that you'll work in us and through us now and in the weeks and the months ahead, for your glory and for the greater health and well-being of those among whom we live and whom we serve. And we pray this in Jesus' name.